You're welcome to another episode of Fertility Talk with Olarunke Thaddeus, compliment of the season. How are you all doing? On today's episode, I want to discuss factors that would influence your IVF success rates. Yes, I know a lot of my women, they want to hear more about this because failed IVF treatments are no longer news, okay? Some even believe that IVF is 50-50. Some believe that it doesn't work at all. A lot of belief here and there concerning IVF, okay? So the truth is that some factors truly influence the success of any IVF treatment. So I will be going straight to the point this afternoon. Okay, so what is IVF? IVF means in vitro fertilization. Is a fertilization that takes place outside the woman's body. The eggs are retrieved from you or donor eggs, as the case may be, and fertilized with your husband's sperm or donor sperm, as the case may be. So the results of the eggs and the sperm would bring about embryos, and these embryos will be transferred back into the woman's womb for implantation to take place. And implantation usually takes place within 14 days, and you will confirm if you're pregnant or not. Okay, so it looks simple, but yes, I've seen a lot of cases where intending parents or intending mothers doing IVF just did it once, and you know it works for them. And I have come across a lot of women that have done IVF plenty times, and it has not worked for them. So what are the factors that determines the success of IVF? Number one is the age of the woman. The age of the woman, you know, affects the outcome of the IVF, in the sense that the woman's egg is, the quality of the woman's egg is only determined by the age of the woman. So women less than 35 years old would definitely have their chances increased, and women of above 35 years old, yes, has a reduced chances. However, if you change the IVF type, probably to a donor cycle, using a younger females to donate as egg donor, yes, even if you are over 40, you can still have your chances increased to that of women of under 35 years. So age affects the egg of every woman. So number one reason is age. So how old are you? In fact, if you have talked with me before and you said, oh, I want to do IVF, that's always my first question. That's what I'm trying to see, if yeah, it's gonna be your egg, or if I will be advising you for an alternative, which is using donor egg. Of course, another reason, another factor that determines your IVF success rate is the cause of infertility itself. Usually when you are looking for the fruits of the womb, except in few cases that we will have unexplained infertility, but for most of the time, yes, there are reasons why there are infertility, and depending on these, it might somehow also affect the outcome of your IVF. For instance, if you have fibroids and these fibroids are located on the lining of your uterus, definitely it's going to affect the outcome of your IVF treatment. So in that case, what you would do first is to firstly remove those fibroids, okay? Or maybe there are polyps in there, or if there are adenomyosis or endometriosis, you know, all these cases, you will probably need to sort them out first if you want your IVF chances to increase. That is the truth, okay? Depending on your fertility, the causes of your fertility, yeah, that it may have adverse effects on the outcome of your IVF. Okay, so this is why it is very important not to generalize and say IVF because it doesn't work for your friend, it might not work for you. You are not your friend. You don't know if your friend has other fertility issues. You might not have it. So IVF might just work for you. You might just be among a lot of women that are doing IVF and it works for them just one time. Okay. Another factor, of course, is the quality of the embryos. The quality of the embryo is the combination of the eggs and the sperm. Okay. Like I said earlier on, the quality of the egg is determined by the age of the woman, and also the sperm quality. Usually, of course, semen analysis will be done, but medically, the doctors would say the true nature of a sperm is exposed when you fertilize the sperm with the eggs. Then you begin to see some genetic condition of the sperm. Okay, so the combination of these two would result into good eggs if both are good. Okay, and if the sperm is bad, for instance, it might affect the egg quality at the end of the day. And if the eggs are not good, of course it will definitely also affect the quality of the embryos, and all this would affect implantation and might reduce the chances of IVF if there are issues with any of this. So if you've been doing IVF repeatedly and there are issues, you need to ask your doctor what it was during fertilization, to know where the problem is and if you would need to substitute, yes, when you're doing the next IVF treatment to help you increase the chances. Another factors that can increase your IVF success rate, of course, is your lifestyle. Lifestyle includes your diet, if you exercise routinely, smoking, excessive alcohol intake. All this can actually have adverse effects on the outcome of your IVF. Okay, so you might need to look inward and change some certain lifestyle if you're planning to do your IVF. Don't smoke at all if you're looking for fruits of the womb, because smoking has a way of affecting the egg quality and also the sperm quality. So all these should be taken into consideration to increase your IVF chances. Of course, I also heard that another factor that would help you increase the chances is the protocol and the medication response. Some IVF protocols, some drugs works better when it comes to stimulation. Some FSH recombinant works better than the other, depending on which one your doctor is using for you. Okay, it might also affect the quality of the eggs at the end of the day. Okay, so this is why you need to use a reputable IVF hospital for your IVF treatment. And if you're looking at doing that in Nigeria, of course you could chat or send us a message to help you out on that. IVF drugs, yes, it has a way of helping to increase or decrease your chances of IVF success rates. Okay, also I want to talk about uterine factor. Of course, I've mentioned that earlier on. Yes, if there are fibroids, if you have done fibroid surgery repeatedly and this has caused adhesion, if you keep having IVF, having embryo transfer, then chances that it might not work is high because of those scars on the lining of your uterus. So the condition of your uterus also determines to a very, very large extent if your IVF will work or not. It is very important to also note that the success rate can vary from clinic to clinic, from individual to individual. So this is why it is very important to make use or work with an IVF hospital that has a good success rate. Okay, so when it comes to IVF success, you also cannot remove the God factor. And like I normally tell all my intended parents, God is good all the time. So if God is good, then if your doctor is good, to give you good drugs. If your doctor is good, to ensure that all the consumable items in the IVF labs are very good and they have not expired, and if your eggs are good, if the sperm is good, if your womb is good, tell me why you should not get pregnant. Okay, so when all these are in place, then of course naturally your IVF chances would increase. So this is my take on all these factors, and I hope you enjoy this topic. Thank you for watching today's episode of Fertility Talk with Olarunke Thaddeus. Looking forward to seeing you in my next episode. If you have any inquiries on IVF, where to do your IVF, you can send us a DM for consultation. Kindly call the number showing on your screen. Don't forget to subscribe to our channel, and if you have, you can also follow us on our social media at Instagram at MidSurrogateMother. Thank you very much, and God bless.